our phones have been a lot busier this week, mainly from Texas patients and also from patients that normally would be seen in Texas. So like, Louisiana, Alabama patients that would go to Texas for care, but can't. And so, I just scheduled a patient from Louisiana yesterday because they can't go to Texas. And so we're seeing kind of a surge of people, not only from the Texas bill, but also from the hurricane that's, happening. And so, our phones have been busier, specifically with out-of-state patients. There's a lot that goes into having to travel out of state to access care. One, you shouldn't have to leave your community to access such a basic, a legal right, to access healthcare. We've been communicating with some of the abortion funds in Texas to help not only help patients fund their abortion care, but also working with some of the practical support, getting them to their appointments, discounted hotels when they get here because they're going to stay overnight. They're not going to drive back to Texas in the same day probably. And so we've definitely been making those communication networks and as well as preparing inside the clinic for what we are definitely seeing. Our week, the next 2 days are very busy for us.